our program. Assalamu alaikum, everyone, and good afternoon. We will begin today's program with a brief Quranic recitation. Bismillahir Rahmanir Rahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatum min lisani yafqahu qawli. My Lord, expand my chest for me and make my task easy for me, and untie the knot from my tongue so that they may understand my speech. وَمَنْ أَحْيَهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. And whoever saves one life, it is as if he had saved all of mankind. And that is from Surah Maida, verse 532. My name is Dr. Mehreen Khan. I'm a psychiatrist, and it is truly an honor to be moderating this important seminar on suicide awareness and prevention. If you are here, you want to be part of the solution, and that is truly honorable. So I truly thank you from the bottom of my heart for joining. Today's event is hosted by AMPWA, the American Muslim Physician Women's Association, and this association's mission is to serve our community through education, advocacy, service. And today's program reflects that mission. So before we begin, a few housekeeping rules. Please raise your hand if you'd like to speak, or you can use the chat option. Kindly keep all microphones muted unless you are the speaker and you are speaking. And most importantly, this is a safe and respectful space. We know that suicide is an extremely difficult topic, but it is one that we must address for our community. Having said that, let me advance my slide to the panel of experts. I will be introducing our distinguished panel of experts today. Dr. Mona Alvi, she's a board-certified child and adolescent psychiatrist. She's also board-certified in adult psychiatry. And on top of that, she's also an expert in addiction medicine. She's board-certified in addiction medicine. Dr. Mehvesh Afrina, she is board-certified in child and adolescent psychiatry and also adult psychiatry. Dr. Faryal Ghaffar is board certified in pediatrics, but also infectious diseases. Dr. Humera Chowdhary is board certified in child and adolescent psychiatry, and she's board certified in adult psychiatry. Dr. Mariam Saleem is board certified pediatrician. And me at the end, I'm the moderator. I am a board certified psychiatrist. Just getting to know this panel of experts, I can tell you with what passion they talk about our community and what needs to be done to help our children and our future generations, and also us as an ummah. It has been really eye-opening, and I think that this is a perfect panel to discuss such a sensitive topic. I am truly grateful for all of you for being here tonight, or today, this afternoon. I will be going through, and I have some questions for our panelists, and I hope that these questions will be helpful for our listeners. These are some of the questions that I hear from the community, so I wanted to ask these to our panel. I'll start with Dr. Mona Alvi. You know, we hear a lot about suicide occurring around us, and it's always shocking that it happens when it happens in our community. But generally, how big of a problem is suicide? What do you see? What are some of the trends in our country?
Well, Assalamu alaikum, everyone, and thank you, Mehreen, for the nice introduction. And today, like you mentioned, we will be talking about suicide, which is definitely a very emotional and sensitive topic. And we are not only talking about the statistics, we are going to be talking about people, families, and community members who are deeply affected. So I'm going to try to keep the conversation as much as possible engaging, and as much as possible, you know, it is an information which is deeply touches everyone. So, you know, I will be sharing some numbers which are very eye-opening, and it tells us how varied this issue is. So it affects not only one age group, it does not affect only one race, it doesn't affect only one culture, it actually affects everyone in the society. And up till now, according to the CDC, it is one of the most leading causes. It is one of the most leading causes of death. So we cannot really minimize this issue. According to the CDC guidelines, the data we have seen, every month we lose 3,500 to 4,500 people to suicide in the United States. And in the year 2023, just in 1 year, approximately, the numbers are still provisional, 49,000 deaths happened due to suicide. So that comes out to be one life is lost to suicide every 11 minutes. So that is right, one life is lost to suicide every 11 minutes. And that is a huge, shocking number. So when we look at the year-to-year rate, suicide is pretty steady, but with some dips and rises. When we look at the month-to-month data, during the winter months, we see some lows and some rises in the spring months to summer months. The rises happen usually from late May through August. So these are the months we should actually be having some more prevention. Although young suicide gets a lot of public attention, but one age group, which is the elderly age group, should definitely get a lot more attention because people who are 85 and above still have the highest suicide rates. Another interesting figure, which actually, I have observed in practice, and also according to the data from CDC, the firearms like guns are the most used in suicides, followed by suffocation, then poisoning, and then other methods. And we do know men make more than almost about 50% of the population, but 80% of the suicides are still actually completed by men. So these numbers, in conclusion, tell us where the risks are, but it are actions that can make a difference. They are the ones which can make a change.
Thank you so much, Dr. Alvi. Those are astonishing numbers, and we generally don't feel like male gender is a vulnerable population, right? Because there's usually children and women, but it sounds like males are quite vulnerable when it comes to suicide. And I know it's such a heavy burden, especially on the psychiatric community. There's psychiatrists which take care of mental health. So thank you.
Yes, Mehreen. Yeah, women tend to attempt suicide more, but men complete suicide.
Okay, but they're definitely not safe and definitely
Correct.
vulnerable. Well, thank you so much. That was truly eye-opening. We talked about men. We talked about sort of, kind of forgetting the elderly community, the geriatric population, older men, who we may think that have it all together and perhaps are not under so much stress. But I want to take the question to Dr. Faryal Ghaffar, who's a pediatrician. In practice, do you see that, young folks, the adolescents and young adults, are they particularly vulnerable with the population?
Yeah, Assalamu alaikum, everyone. So the answer to your question, why adolescent and young adults are more vulnerable to depression, the main reason is their brain has not developed, certain parts of the brain has not developed yet, especially the frontal lobe. And that's the part of the brain that controls impulsiveness, planning, and deals with executive functions. So if there is a situation, stressful situation, teenagers may have difficulty regulating their emotions and impulses, and that makes them more susceptible to suicidal thoughts. In addition, adolescents have higher level of anxiety, and they are vulnerable to substance abuse, which are the main significant risk factors for suicidal ideation in youth and adolescent. They undergo a lot of stressful situations in life. They could have family issues, including divorce in parents, conflict among parents and siblings, instability in the house, abuse or neglect that goes on, peer pressures, peer relationships, such as bullying, social rejection, and difficulties dealing with sexual orientation. They have academic pressures, school performance, school problems, bullying. They deal with losses in their life, including relationship breakups and death of a loved one that they are attached to. In addition, adolescents spend a lot of time on social media, which is a double-edged sword, offering support, but in addition to that, there is some other negative issues of using too much of the social media is exposing vulnerable teens to negative content in the social media, cyberbullying, and unrealistic social comparisons. And that makes them more vulnerable to suicidal ideation. Mehreen?
Yes. Well, yes, sorry. I was looking for my mute button. So, well, so in practice, just a follow-up question on that. You're seeing a lot of that in your practice, correct?
Yes. I see that a lot in my practice. And one of the things I'll say that, as you know, that as we mentioned and talked about, that depression is more common in adolescent and young adults, because there is a genetic component to it. Parents needs to get themselves treated. So this is the problem I have in my practice, that the parents cannot even understand that their child is depressed because they themselves are depressed. So they have lost themselves interest in their surroundings, and so they are not able to determine that their kids are going through these problems. So it's very important that as a family they get treated, which is, I think that's the utmost important thing.
Wow. Okay. Well, thank you so much for sharing that. I'll take it at my next question to psychiatry again. Dr. Faryal Ghaffar mentioned, she's seeing a lot of these young folks that are suffering for a number of reasons. And what advice do you have, or what do you think that family members or loved ones that are seeing these, signs, what should they look out for? What should they do? I'll take that to Dr. Mehvesh Afrina.
Thank you so much, Mehreen. Thank you, Mona and Faryal, for that really interesting and mind-opening information. So some symptoms that I think that parents or family members or they need to look out for is any changes in baseline, from baseline, if the kid was doing well, if the teenager was doing well in school, if there's any kind of drop in their grades, changes in personality. I think that would be the first red flag to watch out for. Persistent low mood, frequent crying spells, kind of being weepy and sad, and changes in mood, lack of motivation, energy. So if you have a kid who's kind of really socially very well connected, and you see a change that they don't want to hang out with their friends or family or want to be in their room all the time, that would be a red flag that parents need to kind of watch out for. For adults, I mean, I think if husband, wife, adult patients kind of really wanting to kind of slowly back away and not really engage as much, declining kind of invitations to hang out with friends, social isolation. I think depression makes people feel like, what's the point? Nobody cares. That's the general sense. So people kind of tend to shy away and want to hide. Lack of interest. I mean, somebody was interested in kind of particular sports or used to kind of be in any kind of band or football team, and suddenly they're like, oh, I don't want to do this anymore. This is not fun. Just really kind of lack of interest or change in that, I think, would be a big red flag. And also dropping grades for kids. I mean, somebody who's been like an A+ student suddenly going to like making C's and F's, and trying to figure out, that would be again something to watch out for. For adults, kind of work performance was being affected, and kind of missing work and not wanting to kind of go to work. Sleeping too little or sleeping too much, That's kind of, sleeping too much, eating too much. That's like atypical symptoms of depression in teenagers and adults. And again, loss of appetite or eating more or eating less. And especially in teenagers and young adults, I would watch out for irritability, just really, mood swings, snapping easily, feelings of guilt, kind of, guilty about nothing or guilty about small things, that really, being overly sensitive, really low sense of kind of, feeling like very sensitive to being rejected. And really last but not the least, especially in teenagers, kind of existential crisis, kind of questioning, what's the point of it? Why go through the journey when in the end everybody has to die and it all has to end? And kind of, looking for ways and means to kind of really, how do you end it? Because in the end, everybody has to die. Thinking about ways, having intrusive thoughts, negative thoughts about suicidality, and kind of thinking about ways to kind of, commit it.
Wow, yeah, thank you so much for sharing that. It sounds like any type of change, and a lot of the times we hear in our community, or we're talking about our children, oh, it's just a phase, or what. So just a follow-up question on that. It sounds like if there is a change that is concerning for functionality, right? Like you mentioned, sleeping too much. So the parents should be aware of that and just kind of keep that in their mind that, okay, this is a change from how he was before. Maybe he was getting A's, now he's getting C's, sleeping too much. So there's multiple things. So just kind of paying attention.
Absolutely, absolutely, yes.
Okay, thank you so much for sharing that. That takes me to our sort of a general perspective of what can we do. And I'll start with Dr. Mariam Saleem. What can we do to?
Sorry, go ahead.
Go ahead,
So
Doctor.
couple things that, I just want to quickly throw out there before you kind of move on is, when there's like dramatic change in personality, I think, a few things that I want people to watch out for, especially adolescent, is even though your kid might be well settled in the best of the companies that you think they are, always kind of really have that in back of your mind when you see that dramatic change is drugs. With the vape shops opening every few miles, that's always easily accessible, synthetic stuff that's out there. If your kid is kind of really, experimenting with that, or kind of have gotten into a bad company or not, or is experimenting with drugs, that would be something that really, I would kind of keep that. And also comorbid conditions like, excessive worry. A lot of kids have underlying anxiety, and it's really difficult to kind of really not be depressed if you have like ongoing underlying anxiety. So just really kind of making sure that we're treating comorbid, any substance abuse illness, any anxiety disorders. If there's any sudden reckless behavior that comes in, then I think we need to kind of really make sure that depression, it could be kind of, early symptoms of something serious like bipolar disorder. And, also drugs can cause kind of, early psychosis, can trigger symptoms of hallucinations and paranoia, and kind of, make people kind of have an episode of kind of, schizophrenia or bipolar disorder. So those are some things that, are a little bit more on the serious side. And I think we need to kind of really keep that in mind. Thank you so much.
No, I appreciate that. So my next question is for Dr. Mariam Saleem. What can we do, and how can we protect our community?
Thank you, Dr. Khan, for asking this question. Now, so again, we know that there are risk factors associated with suicide, and and we'll kind of go over them again. But there's also protective factors which are known to help prevent suicide. And I'd want to go over them, and then that kind of defines the role of friends, parents, and teachers, and in community, how we can pick it up, prevent it. So there are some protective factors which prevent against suicide, which I think is very important. Number one being effective behavioral health care. It's very important that we take it as a health problem rather than a weakness or a taboo associated with that. So if you have an effective behavioral health care system and we know how to seek it, that definitely prevents suicide. Being connected to family, being connected to community, being connected to a social institution definitely helps in preventing suicide. Number 3 would be life skills and problem-solving skills, coping mechanisms. So these are things that parents should work on from the get-go. And we should, as human beings, as adults even, learn how do we manage stress? Do we have the coping skills to handle it, to compartmentalize it, and know how to adapt to change, to adapt to difficult times. So these are things that parents and friends and caregivers can actively work on with children from the early age. When things don't go your way, how to handle it, how to assess it, how to manage it. These are skills that should be worked on from an early childhood, and it actively prevents suicide and even anxiety and depression. They might have anxiety, but they might have better skills to handle it. They might be better at expressing their needs, and as parents, us be listening to those needs and seeking care. Another thing is self-esteem. Self-esteem is something that parents, grandparents can definitely work on. We have to work on our self-worth, and that's important. Self-care is important. So working on self-esteem, knowing your worth, and then and having a sense of purpose in life. That is something that religiously as well. What are we here for? So if that is something that we talk about with our children, with our friends, that what are we here for, and what can we do to make our life fruitful? So these things are important to build your self-esteem, and that definitely decreases the chance of suicide. Cultural, religious, and personal beliefs that discourage suicide, they are definitely this is a preventative, protective factor for children and adults. So this definitely prevents. Now, when it comes to parenting, it starts from early age, and you protect them and you guide them. But as they're getting older, being very vigilant, not only talking to them, but also listening to your child. If your child is showing, that, or he's saying something that he's not adjusting, or showing that he's having a hard time making friends, then talk to them. Show empathy, show sympathy. Try to be very kind rather than being judgmental, and giving them the support. Not have any shame. When you go to your physician on a yearly basis, they'll ask for depression questionnaire. But if your child at that point or another point says that they're having a hard time, taking it seriously, first talking to them, first listening to them, and offering them help, that this feeling is not normal. We can talk to somebody about it, and then seeking help from your pediatrician or your family medicine physician. And that not only gives the child confidence that he's being listened to and his feelings are valid. So I think that those things from the get-go, giving children confidence, importance, respect, their opinions should be heard, and they should be given love and kindness while building their qualities of self-respect, self-worth, and kindness.
Thank you so much. Yes, something you said really stuck with me, that respect for your children, or respect for folks around you. I do hear sometimes that I'll talk within the community that I did tell my dad or I did tell my mom, but they did not think that was, I should be grateful, and, they didn't think that it was a problem. So I'm glad that you brought that up, which really segues into, what can we do to improve our cultural perspective? How could we change that in our community? And I would love for Dr. Humera Chowdhary to kind of take that one. What would you say to how can we improve our cultural perspective? You're muted, Dr. Chowdhary.
Assalamu alaikum. Thank you, Dr. Mehreen, for kind introduction, and thank you for all the speakers for wonderful comments. And it's very informative, and I would that's a very good question. Thank you for giving me the opportunity to address this question. I want to talk about this very sensitive issue, how we can improve our cultural perspective on mental health, and how it starts with safe, non-judgmental conversations. In many of our homes, mental health is still a taboo. We often hear phrases like, get over it, you are so blessed, you don't have a reason to be depressed, log kya kahenge, or just have faith, it will get better, be strong, stuff like that. While having faith is a powerful source of strength, but we also need to recognize that mental health challenges are real and they deserve understanding, not silence. One of the most important steps we can take is to start an open, compassionate, judgment-free conversation. Like Dr. Mariam Saleem was mentioning, be open to your child, be present with the children. So on the same kind of note, ask your loved ones, even, not only your children, I want to talk about all age groups, that ask your loved ones how they are really doing, create a space where they feel heard, not dismissed or labeled. Try to be non-judgmental. You don't have to have all the answers. Sometimes we don't ask those questions because we are afraid if we hear an answer that somebody's not doing well, what am I going to do? I don't have resources or anything. Please don't be worried. You don't have to have answers. Just be present. That alone can change someone's life. As a community, we must shift our mindset. It's a huge mindset. We try to stay quiet and avoid. So I would like to say that seeking help is not a weakness, it's a courage. I would like that mindset to start working. Like, it's a courageous thing to go out, ask for help. It's vulnerable to tell somebody that I'm not doing well. Our Prophet Muhammad, peace be upon him, also taught us to care for the mind, body, and soul. So why do we not, why do we not pay attention to emotional pain? Why do we think emotional pain is less worthy of attention than physical illness? So I would like to say that, we need to break the taboo. And breaking this taboo starts with each of us from everyone's perspective, whether you are a parent, a teacher, a friend, or a religious leader, your words matter. We all have our power in whatever area we are working in our lives. So please replace shame with support, replace fear with empathy. And if someone is struggling, remind them they are not alone and help is available, both spiritually and professionally. So I would like all of us to work on thinking that let's create a culture where mental wellness is part of our conversation. It's not hidden in silence. It starts with a simple act of listening without judgment. I cannot stress upon that more, that listening without judgment. That is such a simple thing, but that opens up so many doors for somebody who is in need of help.
I appreciate that. That was really insightful. I do have a quick follow-up question. When you talk about taboo, that, it starts from home, correct? Like this is kind of the theme that I'm hearing is there's family history, maybe parents are also going through some things and children are going through this sort of, like Dr. Saleem mentioned, self-esteem issues and, anxiety and depression or whatnot. Our community tells us that, suicide is, if you attempt suicide, that is the worst thing you can do. I mean, now you're gone, and there's risk of you not even, making it to heaven. Do you have any insight of like how we can touch on that topic with our community?
So think of it as an illness. I don't know why when it comes to mental health, we do not think of as an illness. And I do this all day long in my clinic. No culture, no gender or color or race is spared from this, that we all have, even we live in this developed country, still we deal with taboo attached to mental illness. So when I use usually a simple example that if you go to the doctor and you get diagnosed with diabetes, you don't feel shame, you don't feel weaker, you don't feel less of a person. But once you get diagnosed with depression or any mental illness, why do we feel that way? And then comes the treatment for diabetes. Doctor recommends insulin or a medicine, we happily take it. But when the doctor talks about treatment for mental illness, we are in a big denial, we don't want to take it, we take it to a different level, we start feeling weak and not not having enough faith, like I started my conversation with that we have all those taboos. And then if different faiths have different beliefs, I think if, I don't want to make it a religious talk, but it is just like I mentioned that we are taught in Quran and Sunnah and Hadith that we need to take care of ourselves as a person, as a whole, which includes body, mind, spirit. Everything is included. Why do we want to leave one and focus more on the other? I think the biggest take-home message could be that please get out of this denial, identify the problem. Once you identify the problem, you're going to seek help, and there is help available.
I 100% agree. I think it's an illness and therefore shall be treated, and that's exactly what we're here to do. And I want to touch, given on, we kind of touched on family history. I know, Dr. Faryal, you talked a little bit about it in your earlier statement, but I would love for you to expand on that. Like, what are the role of genetics, and how important is for us as a community or as physicians to, do early detection for our patients?
Okay, so the answer to this question is, there are a lot of risk factors for depression, including genetics, past trauma like post-traumatic stress disorder, chronic stress, chronic illnesses, certain medical conditions like anxiety, bipolar diseases, schizophrenia, substance abuse. Hormonal changes which we don't think about, and those are associated with puberty, postpartum, and when you're going through menopause. And there are some medications that can also contribute to depression. In my practice, like simple things, asking questions to the patients, which medications you are taking. I have patients on allergy medications like Singulair, and that was causing depression. So there are a lot of different factors, but to say more about the genetics, data has shown that up to 30 to 50%, and most of the data shows up to 50% of the patients who have depression, there is a genetic predisposition. And the rest of the 50% is unrelated. It could be physical factors or other psychological factors. Genetic factors can make an individual more vulnerable to developing depression when exposed or environmental stresses are there. So that is the best setup for them. There is a stress going on and they have a genetic predisposition, so they are more likely to be depressed and have suicidal ideation. While in summary, genetics plays a role in depression, parental behaviors, parenting styles, and overall family environment can significantly reduce that risk of a child to develop depression. So that's why it's very, very important. A supportive and nurturing parenting can help buffer against genetic vulnerability, while negative parenting styles can increase that risk. And when I mentioned before that the parents, because there is a genetic predisposition, the parents may be depressed and they really need to take care of themselves to help their child. The example is just like when we are in a flight, they say put oxygen on yourself first and then put on your child. It's just like that. If you don't get treated for your depression, the chance that your child will get that help is very slim.
Mm-hmm. So important to know. And that takes me back to Dr. Humera. I'd like to, having known that, you've got family that is predisposing you to having, stress and anxiety and depression, bipolar, whatnot, or even substance use disorder. And we come and we speak about suicide, but we hear a lot too that if you talk to my child or if you talk to my family or loved one about suicide, you're putting that idea into their head. They otherwise would not have, thought about it. What do you say to that?
Thank you, Dr. Mehreen. That's a very good question. And this is one question that I often hear in my practice, especially in our communities. Many well-meaning people worry that if they talk about suicide, it might encourage someone to think about it or act on it. But actually, the truth is, which is backed by decades of research, that it's the opposite to that. Talking about suicide does not plant the seed. It opens the door for someone who might already be silently struggling. You see people who are having thoughts of suicide they are often very, feeling alone, they feel ashamed, or they're afraid to speak, they're afraid to reach out and speak up. And when we avoid the topic, it reinforces that silence. But when we gently and directly, with love and care, we give that person chance to be honest, maybe for the first time, it can be beginning of getting help. And let me say that to clarify that you cannot cause suicide by simply asking someone if they are thinking about it, but you can prevent it by being brave enough to ask. And if someone is not suicidal, they won't suddenly become suicidal because you asked. But if they are, your question can be a lifeline. It shows them that they are seen, they are not alone, their pain matters to someone, especially in our religion and in South Asian communities. We often think silence protects. Try to hush and don't talk about things will protect from happening. But in case of suicide, silence isolates, and isolation is what allows despair to grow. So instead of avoiding the topic, let's learn how to talk about it, which is with calm, with passion, with compassion, and without fear. And you can easily ask question, have you been feeling so sad or low that you have thought about not wanting to be here anymore? Are you thinking about, hurting yourself? These are not dangerous questions. Actually, these are brave questions. And if the answer is yes, again, I will say, don't need to be scared. You don't need to be, fix everything. Just stay with them, listen, be available, help them get connected to the right resources, support, whether it is a trusted therapist, doctor, or a helpline. We will be sharing resources at the end. So please, I would again reinforce, remember, talking about suicide does not encourage it. It disarms it. Silence can be deadly, but conversation can save lives. And I want to take this to I want to make a comment that, people ask, like if there is somebody, if somebody is hurting or is sad enough and they are here in this talk, so I want to talk to them. If you are one who is feeling overwhelmed, hopeless, or even thinking about ending your life, please listen. What we are talking about, you're not alone, your life matters, you matter, and this pain, no matter how heavy it is, it's not permanent. There is help and there is hope. Even if you can't feel it right now, you can go on, ask for help. So please don't suffer in silence. Talk to someone, talk to a friend, a family member, a doctor. Asking for help is not a weakness, it is a courage. And also, we know our religion also says that, saving a life is saving like humanity. So please, open up, listen to others, and talk to others.
Oh, that's such a powerful message. Thank you.
Mehreen,
Yeah.
sorry, you asked one question which I didn't answer. It was like sort of part B of the question is early detection benefit. So I just wanted to briefly talk about it. That early intervention is very important because it lessens the impact of depression on individuals and society by preventing its long-term effects. And studies have shown that if you do early treatment, the functional outcomes are better, and it decreases the duration of depression episodes and increases the time interval between recurrences, or it may even reduce the recurrences. And it also helps development of a cognitive style linked to recurrent episodes of depression. So it's very important as soon as we determine that your child is depressed, or as a physician, as a pediatrician, you determine that your patient is depressed, we need to take early intervention because that's very important.
Very nice.
Yes, thank you so much. I appreciate that. Yeah, very powerful messages, and importance of, finding out early on, earlier the better. And I agree, Dr. Humera, about, just talking about suicide won't put any of that idea how Dr. Mariam mentioned the respect, like if someone is going to talk to you about it, and then you're going to obviously ask them, are you having thoughts of hurting yourself, or are you having thoughts of suicide? So that is part of the respect, because you heard them and you are taking them seriously. So really powerful stuff. I want to be mindful of the time. I know I do want to answer or have our panelists answer some of these excellent questions in the chat, but I do want to make it full circle and talk about what we're doing as a community, but also what are some of the treatments and what are the interventions for folks who are high risk for suicide because of all the things that we've been talking about. So Dr. Mona Alvi, if you don't mind speaking to that, what are some of the things we can do as far as treatments and interventions?
Thank you again, Mehreen, and thank you for the panelists for their insights. And I think a lot of things they have already addressed, and it's a great discussion. And one of the things I want to highlight today is a lot of people believe that when someone is truly determined to take their life, nothing can stop that. That belief is very powerful, but not true. So research actually shows us completely opposite. Most suicide attempts are impulsive. People usually decide within few minutes to kill themselves. And from what we know, people who survive the suicide attempts, they never go on to die by suicides. So that tells us intervention matters, suicide is preventable. So what do we do? Well, number one, we take them very, very seriously. People really want to escape from their agony, their feelings of distress. They don't really want to die. So the number one thing we have to do at that time is be supportive. Some of the very simple things you can do is be supportive for that person. Just when you determine that person is going to kill themselves, they have verbalized to you that I want to die, I am suicidal. You never leave them from your side. Be with them 24/7. And I think some of the common mistakes, though they are, we do with our loved ones, though they are very unintentional, I think. Some of the things which we tell them are, oh, don't be weak, just stay positive. And, oh, time will heal. These are the things which I have heard a lot. And don't be judgmental at that time. What happens by these things, by these measures, people tend to feel that I'm not being validated. No one cares about me. And so that is what I meant by taking them seriously. And when you find out that someone is going to take their life, because life matters, so you intervene right away without any delay. And one of the most important things, because I do not want to panic at that time, but we want to stay calm and collective. And there is help out there. Emergency lines, 911, I'm sorry, that is there. 988, there are suicide prevention lines. And if you feel that person has a suicide plan, they have an intent, you take them to the nearest emergency room. You can take them to the hospital. Every county pretty much has a mobile crisis team who can come and assess you at your place. And they can later on come out with a plan for you. And once that crisis is over, research shows us that you provide follow-up care. You never leave them alone after that. That can actually reduce suicidal attempts or deaths. Counseling helps. There's one type of counseling, which is dialectical behavioral therapy, which has shown evidence that it can reduce self-harm behaviors. It can reduce suicidal ideations. There is cognitive behavioral therapy, which can change negative thoughts to positive thoughts. Of course, there are other kinds of therapies. So you want to seek help from a counselor. Family therapy is very, very critical and important because family is an integral part of your treatment. Family can learn how to deal with the person in the time of crisis. And so we continue to provide support. You can also go and see a psychiatrist, and psychiatrists can also do an evaluation. And if you need any antidepressant or any kind of medication, they can also provide that help. So these are some of the things which are available to you.
Wonderful.
In conclusion, suicide is preventable.
Absolutely.
100%. I want to thank everyone and all of our speakers for their, for answering all my questions. We will get to the questions in the chat, but I do want to ask our, expert panel to give us that one-liner of, like a thoughtful insight to close off, like a final message for our audience to take home. I'll start with Dr. Mehvesh Afrina.
I think as community, we need to get over the stigma of mental illness, as Dr. Chowdhary pointed out, kind of, not weakness. And one thing takeaway from that I want our audience to take away is that when in crisis, if somebody has a heart attack or a stroke, you would take them to the ER and seek help. Just like that, when somebody is suicidal, they need to be taken to the hospital and, help should be seeked. There is place for kind of spiritual guidance and all that, but when it's crisis and emergency, depression, anxiety has a lot of organic, it's neurochemical imbalance. So there is treatment, just like we would have treatment for stroke or a heart attack for that. So please break the stigma and seek help in the right way. So, there are psychiatrists who prescribe medications that help with depression, anxiety, bipolar, psychosis. So, we need to kind of really make sure that when there is a crisis situation, that we go in the right direction and seek the right kind of help. Thank you.
Thank you. Dr. Mona? Any parting words? Am I muted?
Mona, you are muted.
I think let's move on to somebody else who can.
Dr. Mariam?
Sorry, I came on. I'm sorry, technical issues. Sorry, Mehreen. Can you see me?
Yes, we can see you and hear.
Sorry, it's going to be a little more than a liner, but the message to the community from me is actually that we need to break the barrier of how to communicate to our kids. And in some cultures, we do not allow the kids to talk. We let them stay quiet, don't let them express the emotions. And then what I want to say is silence is not protective. It actually causes the pain to be heavier. It makes them isolated. It causes more mental health issues. So we as adults have to break this cycle of this silence. And how we do that, we provide active listening. And when kids feel heard, it causes a sense of acceptance. It improves their self-esteem, confidence, mental health, and it gives them a will to live. Thank you.
Thank you so much. Dr. Mariam Saleem?
Yes, I would want to say, it's a simple message, but it's an important one. Listen to your children, support your children, respect your children, and be present for your children. Spending time with your children is different than being present for them. Actually be present so they actually know that you're there for them, you'll support them, you'll listen to them, and you'll seek help for them if they need. So that is my message is take care of them. They are a blessing and they need to be taken care of. Thank you.
Yeah. Dr. Faryal, Ghaffar?
Yeah, one of the things I will say as a community, what we can do is reduce people's isolation and increase their sense of belonging by communicating with them, by contacting them, be there for them, and have support groups where the other people can share their information, their experiences, which tells them they are not the only one. Other people went through this and how they coped up with this. And one of the other things that I wanted to say lastly is that in your practices, in doctors' offices, there should be information provided to people. If they need any help, they're depressed, then they should speak up. And there should be resources, that there are resources available, and in a form of, they can put a poster there, which is usually very helpful.
I'm glad you said that, because what we're doing today kind of goes into that bucket of we're talking about it and the community is there for you.
Yeah.
Thank you so much, Dr. Humera Chowdhary.
So yeah, most of the people have addressed a lot of things. So I would like to, couple of thoughts I have, a little bit more than a liner, that like I would like even the adolescents or adults or whoever is suffering, like I mentioned earlier, that they should become brave and they should speak up. And encouraging them is huge process, that they need to break the silence and reach for help. Don't think that there is no help available, and don't be afraid of other people being judgmental. At the same time, again, going back to the culture, I would like to say that let's replace judgment with compassion, curiosity with kindness. Sometimes the most loving things that we can say is, I'm here for you, and no questions asked. Just be present. It's a little bit different, like not present physically, be present emotionally. Dr. Mariam Saleem also mentioned the same thing. And just be present for your children. It's a big thing that they need to know what is their safe space, where they can talk about anything that they feel like. And as parents, as community, as teachers and adults, we need to let them speak in a safe environment without being judgmental.
That's so powerful.
And that also comes with, like, we need to give them a clear message that we respect them. We have to learn how to respect their boundaries, and they need the respect, whoever they are, whatever they are doing. We need to be respectful and communicate in a respectful, compassionate manner, not being judgmental. I cannot stress enough on that, not being judgmental.
Yes, I heard that from every one of our expert, the judgment part, and the kids, if children feel, or your loved ones feel like you are a safe space, then they will talk to you. And like,
if you give me a moment, I just have a little, like a rough example, like, in our children, they internalize it. Even if we say things to them or not, they have this inbound pressure on them.
Recording is being recorded.
So we, like, even if I don't say to my child, what do I expect? They already internalize it, and they are under a lot of pressure. So that makes it even more important. Like sometimes, some elders, they, out of love, out of curiosity, they ask questions. Like, what are you doing? Why are you not doing medicine? When are you getting married? When are you having children? So these seem like very simple questions, but if you see from the person who they are asked, they could be considered as pressuring, as judgmental. They can cause a lot of unnecessary pressure. So again, my request to our community and our culture is, let's just be compassionate, be there, and be available. Don't be judgmental.
thank you so much, Dr. Humera Chowdhary. I want to go and address some of these questions, and I'll open it up for any of our panel experts to answer. Our first question is, how common is the symptom of irritability when they are depressed?
I can take that
take
question. It's a very common symptom, especially in adolescent, in teenage years, in younger children. It's very common to see, because they don't have the capacity to say, I'm sad, I'm depressed. So they are, most of the time, they are easily irritated. Parents come and tell us that we are walking on eggshells. No matter what we say, they are irritated, they are short-tempered, they are short-fused. All these symptoms are very common, and they many times are leading towards depression diagnosis. So we should not take it lightly. Like I have some parents who are like, okay, now my child is in their puberty years, they are becoming a teenager. So what is teenage? What is depression? So someone has to assess very carefully. I would also say it's a team approach. You cannot just go to the doctor and consider the doctor is going to fix my child. You have to be patient. You have to have, it's like a team approach. You need a psychiatrist, you need a therapist, you need a counselor, you need different parenting. So yes, irritability is a very common symptom of mental illness.
And I also want to add, irritability is one symptom. So it's just having an irritable child doesn't mean that they're necessarily depressed, but it is one of, like Dr. Humera mentioned, and I believe it's also quite common in male gender. Depression in men looks very different than it does in females.
Yes.
Another question that I have for the panelists: how do you differentiate between ADHD and new onset anxiety in ages 6 to 12?
I can take that. ADHD is kind of, it's like this dopamine kind of, deficiency in the frontal lobes. So there are multiple kinds of ADHD, inattentive, hyperactive. And there is significant issues, not just in kind of one setting, but couple settings like school issues, inability to sit down and focus and follow and complete the schoolwork. The same thing goes on at home too. So the ADHD child will not be able to kind of, get two directions. Mom's, that's the common complaint is I tell him one thing or her one thing, and they're not able to kind of, process that information. So that's really difficulty kind of retaining information and really processing that. Frontal lobe is what gives us finesse. So finesse in executive functioning and really kind of, delivering everything in a refined way. And when there's an issue with that, then that's more ADHD. And I think as a child psychiatrist, I think, obviously I've been in practice for more than 20 years. So I can say that, you can differentiate between ADHD and anxiety easily, but I can see where kind of, they could kind of go hand in hand. I mean, having ADHD can kind of really make the kid anxious because they're really that kid in class who's just being identified by teachers constantly because they're not sitting still in their place and not focusing and completing the work on time. Versus anxiety, which is like excessive worry, clinging, especially that age group of 6 to 12, where a little bit of that is developmentally kind of normal, but also kind of, anything in the end, from psychiatric, from DSM standpoint, anything that's not anything that's affecting their normal functioning, day-to-day functioning, anything that's excessive does qualify for the diagnosis. We've all been kind of inattentive, we've all been anxious, we've all cried, we've all been depressed at some point of time, but that really has not affected our functioning. So when it comes to their functioning and, if the kid is too clingy, too anxious, too worried about stepping out of the house, constantly being worried about being judged by their peers, by their teachers, at home people, I think that kind of, comes more in the anxiety realm. I hope this helps.
An excellent answer to that question. I learned some things from that too.
Thank you. Thank you, Mary.
Of course. Next question. What about when parents are having problems with each other and children don't know what to do and it results in unfortunate results?
I can take that one.
I think that's that too. So when it comes to, and this is common as adults, sometimes, stresses, environmental stresses, be it, relation between the parents, financial strains or medical problems can happen. Again, as I said, it comes down to respecting your child, being honest with the child. If any dynamics are happening in the family which are significant, I think involving your children around the age of 4 to 5, children have a little bit of grasp of, what's going on. So talking to them in their own language at their understanding level, even if parents are going through divorce or separation, that should be from both parents have their role, of discussing with their children what they're going through. But still they need to be told that they're loved. And that does not change the relationship that the parent has with the child. So honesty and respect to the children, even when a family is going through any kind of turmoil, I think makes it a little easy. And then we have support system for, family counseling in case the parents are wanting to get some help, or, their issues with anger management, or one parent could be going through depression, but seeking help not only individually, but as a family, and then being open with your children and talking to them so they don't feel isolated, or they don't feel guilty or somehow responsible for, because a lot of time when parents are having issues and the children are kind of aware of and not aware of what's going on, they tend to blame themselves, and that's not fair. Our children should not carry our weight. So important is to kind of talk to them, going through what is going through as a family, and then seeking support individually if needed, and as a family is needed, so that the family can come out stronger rather than weaker from that. So I would say that is the right approach.
Thank you so much. Next question. I want to ask the experts at what point you would advise parents to specifically ask the teenager if they are experiencing any thoughts like not wanting to be alive. And then there's a follow-up question to that is, what would be your advice for parents on how to handle it when response is positive?
I think I can kind of, so going back to what I said, watching out for what do you watch out for when the person is depressed? The symptoms that I went over a few minutes ago. So any changes in behavior, depression, anxiety, low energy, failing grades, I think that's when you check in. And if the response is positive, I think, seeking help, either an appointment with the psychiatrist, the pediatrician. Most of the time, these questions are screened at the pediatrician's office too. And any physician. And then if the symptoms are mild, I think they can start out with therapy. And then if they're kind of more on this moderate to severe side, medication. And if they're suicidal, they need to be kind of taken to the hospital, and appropriate treatment needs to be kind of, seeked immediately. Again, one thing to remember is past behaviors are predictors of future behaviors. So if you have a child who's attempted suicide multiple times, then that puts them at really high risk. So at that point, I think spiritual guidance or a counselor is really, I think they're going to need a little bit more high level of care, psychiatrist, medication, PHP, day hospital program, intensive outpatient programs, and if need be, inpatient hospitalizations.
I'll just add one quick thing to it is it's very important as a parent to make sure that you visit your pediatrician every year, for a physical, because we do from 12 years and over, we do a routine screening test, and we will do a screening test even before if there are some symptoms that alert us that the child could be depressed. And I have seen that few times or more than few times, the parents didn't bring the child for that possibility of depression. Just asking the questions, start asking a teenager, okay, are you depressed? And they'll start crying. Or I have patients that will come with stomach issues, fatigue, and we have tried to done all the blood work, imaging, send them to the specialist, and you cannot find a cause. And then later on, talking more to the patient, we find out that they are depressed. So it's very important that as a parent, of course, you need to look at what are the changes, symptoms are changing in your child, the child is acting different than before. But also taking to a pediatrician is like a second, it helps as well.
I agree completely. I think that's really the most important, because I know most of the screening is done by, pediatricians. So thank you so much for all the valuable work that you guys do. Really appreciate that.
Yeah, a lot of the times, pediatricians or your primary care physicians are the ones that are really noticing and then referring to psychiatrists. But as parents, what we use in psychiatry is that, the patients can be depressed and they can have suicidal thoughts. Where we start worrying and asking the parents to take them to the hospital is when their kids or their loved ones start having a plan. Once your kid, when you politely ask your child, or very kindly with no judgment, like, okay, you're having thoughts to hurt yourself, always follow up with, have you thought of, what you were going to do? Or do you have a plan in mind? And if they have a plan, it has gone too far. If their brain has thought of that plan, that means that they are actively thinking about pursuing that. So if that happens, like Dr. Afrina mentioned, that's the time you cannot handle that by yourself. It is too late for that. So you have to seek help, meaning that not an appointment with a psychiatrist, the hospital. That's, it's what we call the mental health crisis. We have a lot of folks who have suicidal thoughts, but not necessarily a plan, who can continue following up with a psychiatrist and get help with depression. But when you have a plan, that's a crisis. So you need to go to the hospital. We have a comment, we should educate our children to show empathy and emotional support to those going through mental health illness at school and community level. But that is quite lacking in our community. I agree, and I think that's where the panel is from, is to kind of talk about it at a community level as well, because if we don't know how to do it, we cannot teach our children how to be empathetic towards folks who have mental illness. Another question I would love for an expert to take: what happens when the person struggling doesn't want to go to therapy?
And Mehreen, I think that happens a lot in our practice, right? Especially when we are dealing with an adult, when it is really, really hard to get them to a therapy or to a psychiatric appointment. And the family members are at the mercy of the person, how to get them to treatment when the person they know is so hopeless. So I would say you still have to respect, if they are reluctant to go to their appointment. But one thing, and that was the message I had at the end of the talk, that we still have to keep our communication going. We still be talking to them. We do not leave them alone. If they're not going for their appointment, what can we do? We have to still provide some alternatives, to see, are they open to go to some peer support groups, or there are any other programs in the community which they can trust to go to any group therapy, or are they open to any kind of online resources? I would try to see what is keeping them from going. Sometimes is it the stigma? Is it like somebody is going to find out that I'm going there? Or maybe sometimes they just don't want their family to be part of that. So definitely you want to provide those alternatives. So but I would just keep that conversation going. But I will not let them alone. Sometimes they may have a friend who can talk to them, who is more trustworthy. And as the trust grows, they may be willing to go. Now, of course, in an emergency, you gotta do what you gotta do. You have to use those suicide prevention
call
lines.
911.
Yeah.
And I think
So you have to.
One point that I think I want to make, I think these are for mild, what Mona suggested was for mild to moderate cases. Recent homicidal cases that have happened in past few years, without naming any in our community, has been by patients who've been floridly psychotic, were paranoid that their family was after them. I think in those cases, there's really not much to engage. I think in those cases, the family needs to call 911, get the patient under mental health warrant and get admitted to the hospital and treated. In case the cops don't really, take the patient under mental health warrant, I think then there is a way that family can go and get magistrate's warrant, which is, you'll have to kind of go and apply and say that patient is kind of mentally unstable, psychotic, or unsafe. And then the magistrate will get a warrant for patient to be admitted for mental health treatment.
Yeah. So sometimes, those families think, oh, that, that patient or the person, my loved one will go against me. So you have to really talk to the family gently, this right now, what if your family is having a heart attack? You're not going to think about that, right? Once they are going to be stable, they actually will thank you, right?
Yeah.
So you have to let them know that.
Absolutely.
Let's move to just for, it's an amazing discussion, but because of time, I'm having to go ahead and go to the next question. My question is how to diagnose the suicidal emergency in already diagnosed people, maybe with mood disorders or depression, because most of the time waxing and waning behavior of such disorder masks such suicidal symptoms. And also, especially in developing countries where still we are unable to get advanced management for treatment-resistant depression, and psychiatric medicines are dependent on international pharma imports.
So I think past behaviors are predictors of future behaviors. Severe suicide attempts kind of came really close to committing suicide. Several attempts, yes. When they say next time that they're suicidal, seek help, seek admission to inpatient. And it's an unfortunate thing, I think, but I think even developing countries are kind of catching up. There is kind of, help there. Maybe not advanced treatments like, United States, but I think slow and steady, they're getting there too. So yeah, I mean, I don't know what we can do about that, but I think, seeking help and making sure, I think there's some injectables out there too. So whoever qualifies for that, making sure that we get right treatment appropriately in time is the key.
Yeah, and I'll add to this, keep the environment safe, like, not keep guns, in the house, keeping them away. So keeping a safe environment, that's what I tell as a pediatrician to my patients, the parents, that if your kid is suicidal, make sure, you are not just leaving your gun on the counter and stuff, because that's an easy access. So safe environment.
But I would add that awareness is the key, but I think in the developing countries, the awareness is still low. And, the numbers, seeking help is still, I think, low there.
Yeah.
Right. So we were kind of, so again, the message is that awareness has to be there. The taboo needs to be broken. We need to break that silence. Families of person who is struggling, we have our role to do. People who are struggling, they have their role. They can also seek help. So most of the time, what we are kind of hearing over and over again is break the silence, break the taboo, open up, provide safe environment, reach out. We are talking about preventing. So it is preventable cause of death, what we are talking about. And pediatrician and primary care doctors, I would say they are the gatekeepers. Many times they are the ones that they are identifying the people who are depressed or who are suicidal. We psychiatrists come in later. And like Dr. Afrina has mentioned, all the symptoms and causes of suicide, like suicide is not an illness, it is a symptom. Like we talked about it, that there could be anything: depression, anxiety, schizophrenia, bipolar, drug abuse, violence. Any reason can lead. Even I see children with or adults with chronic medical illnesses, people with financial stressors, people with domestic violence, they resort towards suicide because it's kind of the mind takes you to that shortcut, that escape. So it is not one illness, it comes under a big, huge umbrella. All we need to do is we need to identify it, have awareness, and then seek for help. And as community, we need to be available, being passionate, compassionate, non-judgmental.
Absolutely. And I think one thing I want to add, a takeaway point from Dr. Faryal is that, not just locking away guns, but also make sure that you're locking away all the over-the-counter medications, the Tylenol, Advils, which are actually fatal in case of overdose. So making sure if you're dealing with a high-risk person, not just the guns, pills, sharps, knives, all of that. So just make sure that access is pretty limited.
Yeah.
And one thing I think I was just remembering we haven't mentioned, if there is previous family history of completed suicide, in any case, that increases the risk of the current person's suicide completion. So we need to pay attention. What is the family history? Has anybody in the past completed suicide?
Yeah. One thing I will quickly add, because I had some cases in my clinic that the kids were depressed, very depressed, and they were seen by psychiatrists. They were on antidepressant. And, being on antidepressant doesn't take away your risk of committing suicide. And I had a patient who was 12-year-old who was given antidepressant bottle in their room, and they were taking it. And I had a talk with the mother, and I said, it's a good idea not to keep all these tablets in front of her. And one of them ended up taking quite a bit of the tablets, and she survived. But you have to be very careful with these kids, big quantities of medication stuff, giving it to them. You have to be careful.
Absolutely.
Okay, well, thank you so much. I think Aksa, the one who asked the question, just like diabetes can come back if you're not being treated well, depression can come back, and suicidal thoughts can come back. So the waxing and waning behavior of such disorders is just like any other disorders. But that's such a great question, and we're obviously limited in developing countries, but we're also limited here in a lot of things. So. And then we have some comments, and then let me see if we have, there's a resource that someone shared in the chat, if someone would like to look at that in Plano. Some suggestions. I'm looking for some questions. Yep, yes, 100% looking for all depression. The comment is checking blood work can detect low thyroid and anemia and may be causing depression. Yes, so anytime that there are symptoms of depression, there is a full workup, a medical workup before we even diagnose them with depression. So that is true. What kind of supportive words can be used to help the child? Learned what not to say, but need some guidance regarding supportive words. Does anyone want to talk about some supportive words that our parents can use for their children?
I think the first thing that you say is, first you acknowledge and that the child share that with you and thanking them for feeling safe and comfortable to share that. And then saying that it was very brave of them to share that with them, and acknowledging that feeling of feeling hopeless or feeling alone is not normal. And this will be taken care of. We will do it as together. And also at the same time, in a way, acknowledging that this is not an I problem, this is a we problem. So we will seek help, we'll figure out how we can do that. So first thing is acknowledging, showing empathy, and acknowledging that this is not a normal feeling. You don't want to normalize feeling depressed or feeling isolated. And then further asking questions for how long have you felt like that? Have you talked to anybody about it? What made you think of sharing this with me today? But also in a very not in a very supportive manner, almost in a humble manner. You want your child to feel comfortable and acknowledging that they were brave to come up with sharing this information.
And I'll say to be your child's friend. Listen to them. If you are your child's friend, they will feel comfortable. You are not just a parent, you be their friend, so they can communicate with you, they can share their feelings with you, and they feel safe that they can do that, and you're available for them.
So communicate like in a non-threatening manner.
Yes.
I think the biggest thing that many times I see is that there is loss of respect. So we think of children as children or adolescent. Please treat them as humans, treat them with respect, and then that speaks volumes. Your tone, your body language, your statements, it's everything. You cannot just memorize some statements that we are saying here and say it in a different body language or different tone. These are human beings. They are very sensitive to our tone, our body language, the manner that we speak. So we need to be respectful, compassionate, and non-threatening.
I also
I think-
feel, sorry, I didn't mean to cut you off. I also feel that, as a parent, as we are growing up and they do see as adults, no matter how successful you are, academically or job-wise, I think showing your children again and again with your ways that you are vulnerable as well, you make mistakes as well, you go through grief as well, and you take your time in handling, that teaches them grace to handle and acknowledge that we are human. And the human factor, you don't want to have that pedestal that parents are almost, yes, we are also human beings and we also go through. So that teaches them it's okay to fail at things. It's okay to not be successful the first time around. And then to acknowledge that we also make mistakes and it's okay to
Yeah.
share, and knowing that their unit is the family or friends. So they always feel that they are loved and cared for and not judged.
One
It's
more,
I
almost
think
like you.
one of the
more,
things
I know we are
which,
all having a lot of ideas.
yeah,
Please avoid comparing them.
Yes.
Like, it is a
yeah.
very, like a quick reflex to compare them to such and such's children or such and such's. So that is very dangerous. It never comes across as positive.
I think as a part of awareness, so what I want to add is, what I see in my practice, when parents come to you, they have no idea. And I don't think it's intentional, but they think they cannot distinguish between mental health and their intelligence. So a lot of times you get to hear, my kid is very intelligent, they are very smart, they make all A's, they excel in school. How could they have depression? So the emotional intelligence is different than their intelligence in school. So you have to really make them understand these are two different things. So that is a challenging thing for a lot of parents when they think their kids are excelling in school, they are making all A's, and then what is this? How could they be depressed, or how could they have anxiety, or how could they have bipolar disorder? So that is something, and that is the process of denial, which really puts a barrier for them seeking help.
Very good point.
Any other thoughts?
Yeah, I'll just say to have time with you, spend time with your children. Just like a simple family meal, having a meal together with your kids, you can know so many symptoms that you might not have noticed. So I always tell the parents that, the parents will say, oh yeah, my child lost weight, and I later on determined that they were depressed. And I asked the mother, I said, so he was not eating good, or what was going on? They said, oh, I don't know. And so that's why I tell the parents, spend time with your child so you understand. Like having meal with them, having the dinner, everybody have the dinner at the same time. That really helps.
So I think
time.
one thing is, going back to the question, I think that was asked, is like, try not to kind of, really get your kids involved in your fights between wife and husband and ask them or force them to take any sides. And the kids are gonna, as a mother of three, I can tell you that the kids are gonna see the parents disagree. But I also show them that you can reconcile, that it's okay to make mistakes, it's okay to fail, and not fail one time, but multiple times, and really kind of be able to come back. Failure is part of life, and there's really nothing wrong in failing. That, there's still going to be so many chances to kind of really succeed. So I think as parents, just really one big takeaway is they're going to see you kind of disagree or maybe in fight sometimes, but really try not to make them take mom's side or dad's side. Just really kind of, let them be kids and really don't put that burden on your children.
Very good tips. I would also like to add, I know we kind of talked about the nonverbal cues, the body language. So when and someone mentioned that you need to be not just be present, actually be spending time with them, then some of the nonverbal cues are like eye contact. So if your kid is talking to you and you're on your phone, turn around, look in their eyes, make sure that they know that you are present and you're listening. And something that I heard a while ago and has stuck with me, and I try to remind myself all the time, is that it's not about what you don't say, but it is what you say. So if you say something bad to them, like you are a bad kid, parents get angry, and that's normal behavior. But when you say that, the kids don't. They don't stop loving you. They stop loving themselves. And that's where, that's the scariest thing for us to witness. So having said that, I think that was the last of the questions that we had. I do want to share a resource list that we have created, and I'll go ahead and share my screen. Let's see. Are you able to? Are you guys able to see it?
Yeah.
Source screen, perfect. So some of the resources that these might not be local to where you live, but there is a national suicide prevention lifeline. But if there is a mental health crisis, like some of us mentioned, if there is, suicide and a suicidal ideation and plan, or just any type of crisis, it could be, someone starting hearing voices or seeing things, and just not acting the way they're acting. If there's a crisis, the number to that is 988. It used to be 911 for everything, but they changed it to where if you're having a mental health crisis is 988. There is also a DFW crisis hotline. You guys can take a picture of this if you'd like. MCC for Human Services is a Muslim community center that has been offering counseling services in the area for a long time. And their number is there. And now even your pediatricians and your primary care providers, or even your OB and gynecologists can call in the state of Texas if their patient is having a mental health crisis or needs any mental help. So these are some of the resources. And if you feel like you would like to know more information, I have put down the AMWPA email address down there as well. And AMWPA also provides some counseling services around the area. So if you have an inquiry, you can email them. I know we went way over time, but the information we were getting from our experts was just too important for us to cut this short. But as we come to the close, I want to sincerely thank each of our speakers for their wisdom and compassion. And thank you, every single one of you, for being here because you want to be part of the solution. So I want to encourage that the conversation, it doesn't end here. It's an ongoing effort to prevent suicide in our homes, in our communities. So on behalf of AMWPA, AMPWA, thank you for joining us. May Allah bless our efforts, give us the strength, and protect our community. Again, Jazakallah for coming, and everyone have a great rest of your afternoon.
Ameen.
Thank you very much.
Thank you.
Amin. Thank you.
Thank you.
Thank you
Thank
so much. Assalamu alaikum, everyone. That was excellent and
Thank you.
informative. Thank you.
Thank you, Amal, for joining. Thank you.
Okay, Allah Hafiz.
Allah Hafiz.